Hi, hello there. Oh, welcome to another edition of my YouTube video. This edition, I'm going to be talking about pregnancy. Yes, I'm going to be talking about pregnancy. The last edition was about lifestyle principles, and I'm sure that it's likely you listen to the 5 love languages. If you have not listened to it and you're getting married, or you're married, or you have children already, or your children are already grown, emergency, you need to listen, you need to watch that video. After watching that video, you need to still read the book. But in this edition, I will be talking about threatened abortion. There are different kinds of abortions. We have threatened abortion, missed abortion, inevitable abortion. One leads to the other in most cases. But in this edition, I'll be talking only about threatened abortion. Threatened abortion is a very common case amongst women that are pregnant. It is a very common condition that occurs. So it's something that has to be talked about. It's something that we need to educate more and more mothers about. So if you're watching this video and you're a mom, please send this message, this video, the link of this video to other mothers. It is very, very important. Please, I beg you, because ignorance actually is a problem, and ignorance is a major problem in this part of the world. In developing countries, we have lesser access to information. Things that are supposed to make just one information, just one sentence can make a world of difference in your health, in your reproductive health as a woman. It can make a world of difference. Just hearing one word, one sentence can make that difference between life and death for a woman. Do you know that 303,000 women die every year as a result of pregnancy-related complications? Do you know that? Look at that figure. It is actually very, very scary. It is actually very, very scary. So pregnancy complication, this threatened abortion is just one out of myriads, a lot of complications that women experience as a result of pregnancy. So what am I going to be talking about today? Like I said before, I'm talking about threatened. Another word for threatened abortion is threatened miscarriage. So maybe I should use that word, threatened miscarriage. That is, the miscarriage is threatening to happen. It's threatening to happen. It's showing you signs that I want to come down. The baby is showing you signs that I want to come down, as in I want to evacuate from here. But the good news is that it is not in all cases that threatened abortion leads to an inevitable or a complete abortion. It doesn't actually need to progress to that level. If the right thing is done, if information gets to the woman and she knows the right thing to do, and she gets to the hospital and gets help on time, then she may not lose that child. Now, some people, there's a general belief, threatened abortion, nobody really knows the cause, but there's a general belief that it is caused by low level of progesterone in the system of a woman. So in most cases, okay, what are the signs of a low level of progesterone? Number one, vaginal dryness. You just notice that your vagina is not usually as in producing the normal fluid it should produce. It's just always dry, as if you are in menopause already. But if you don't know what it feels to be in menopause already, you may not know what to do. Really, we have taken this topic in the VIP Moms Academy. We've taken it about 2 months ago or thereabouts, and it was fantastic. So many people were like, so something like this is happening, and I didn't really know. Oh, so this is what happened to this person. Oh, this is what happened to this person. Really, that is how it actually goes. But if you are not aware in time, if you're not educated in time, when the thing would have happened to you already, it would have become a story before you now realize that you should learn, and a child is lost already. You have to start the process all over again and start praying again and hoping for a child and trying for a child and trying to conceive. It's actually a lot of heartache that TTC mommies go through. You understand? Some of them, it's not as if they cannot get pregnant. Some of them are actually getting pregnant, but they just happen to be losing the pregnancy. So apart from vaginal dryness, the person would usually experience abdominal pains or be experiencing some spotting. So once a woman is or tender breasts, when she touches her breast, she may feel tender. So it might be a sign that she has a low progesterone level. So for these women, part of their management is for the doctor or the obstetrician to be giving shots, doses of progesterone to that woman to help her to progress through that level, to the level where the pregnancy is no longer threatened. So when is the commonest time that this threatened abortion happens? You called something threatened miscarriage when the pregnancy is below 20 weeks. Once a pregnancy is above 20 weeks, it's no more miscarriage. It's now, threatened loss, threatened labor. It's already premature labor. You're already talking about premature labor because the baby has already moved from the stage of being so small. It has now gotten to the age where you can call it a child. So you are now talking about threatening labor, that this person is threatening to fall into labor very, very early. That's as early as 20 weeks, 24 weeks. That is what leads to premature babies. So it's premature labor that leads to premature babies. So threatening abortion usually occurs below 20 weeks. Now, it most commonly occurs around 9 weeks to 12 weeks. So by the time it's occurring above 12 weeks, it's very rare. Threatened abortion occurs to women above 12 weeks very rarely, very, very rare. So most times it happens within the first 3 months. That's the first 12 weeks of pregnancy. That is when that's when a pregnancy is usually threatened, that I want to leave. So once a woman can scale through that period and enter the period where maybe 13 weeks, 15 weeks, 16 weeks, 20 weeks, then that tension is over. That tension reduces and the symptoms are likely to go away, and then she might progress to a normal delivery, very, very normal delivery. There may not even be implication that she was bleeding during pregnancy. She may not even have anemia. She may not have any issues. So what are the symptoms? The major symptom of threatened abortion is spotting, is blood. That's seeing blood on your pants, seeing blood. So this level of blood can be in a range. It can start from just spotting. For you, it might be just spotting. For another person, it might be heavy bleeding. It might be a lot of blood that will be used. You see, like as if it's menses. It can be that much, and it can be like a drop of blood. So it can be in that range. Anywhere you find yourself between that range, it is still called threatened abortion. It's still called threatened abortion. So what are the risk factors? What I mean by risk factors is, what are the conditions or the situations that can predispose one to experiencing threatened abortion? Number one, what I would like to highlight first is uterine problems. There are a lot of uterine problems, but the commonest that people see in this part of the world is incompetent cervix. So when the cervix is incompetent, that is like any uterine problem that has to do with the cervix not closing up properly. It's supposed to be closed up during pregnancy, not supposed to be open. So anything that makes it to be lax, to be relaxed, it can lead to loss of blood. Then another risk factor is chronic problems. When we say chronic problems that has been in the person's system for a long time, for instance, obesity. Then another risk factor is taking of drugs. You know what we mean by drugs now, not paracetamol. I'm not talking about paracetamol. Taking drugs, then taking alcohol. So if you are alcoholic, if you are taking alcohol before pregnancy was achieved, you need to stop taking alcohol. Really, you need to stop taking alcohol. You need to stop it. You can start reducing it. Maybe as you're praying for wedding, as you get married, you should start reducing drastically, because apart from threatening abortion, alcohol is a risk factor for many conditions in pregnancy. Placenta previa, placenta abruptio, a lot of emergencies, a lot of problems. So just save yourself the stress. Smoking too is a risk factor. So if you smoke, begin to reduce it. Reduce it to one igi, one bere, what do they call it? One stick. Just one stick. Then we try to reduce it to the barest minimum. You understand? So I've mentioned about 5 risk factors already. So Another risk factor is age. Once you don't have your children within your first 35 years of life, and you're having children, you are trying to initiate pregnancy or get pregnant above 35 years, it is a risk factor for many conditions apart from threatening abortion. So that is why people will always say blah 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 blah. It is true to some extent, though. We have deliveries from 60-year-old women, from 50-year-old women, 55-year-old women, and even Sarah had a baby. So there is nothing that is impossible with God, but it is best you do everything. So if you are getting married at 30, you don't need to do family planning in between your children. You can do child spacing, 2 years, have your first child, hope for twins, then finish up before 35, before 36, before 37. That's just the best. In every way, it's better. Make sure you just space the children so that you don't have them every 9 months. Because if you're having children every 9 months or every year, it will be extremely stressful for you. It can disbalance a lot of things in your life. So dear mom, I will encourage you, don't try it. After your first child, if you know that you are very sexually fertile and your husband is also very fertile, you may not know, so that's why you have to take action. Once you have your first baby, the first sexual intercourse you are going to have with your husband, at least use condom. Even if you cannot get to the family planning clinic, at least you can go to the pharmacy and get a condom, please. Because that very first one, some people will have sex after 2 months, and that very first time the husband enters again, it becomes a baby, and in 9 months another baby comes. So just try as much as possible to use. There are female condoms, so if your husband decides not to use condom, look for a female condom and use. If you cannot do that, go to the family planning clinic and have one shot, just one shot of either Norris Terax or which one is this one I'm using now? Depo-Provera. Just one shot. One shot of Norris Terax will carry you for 2 months. One shot of Depo-Provera will take you for 3 months. Even if you have all the problems in the world, one shot cannot kill you, but it will protect you from getting pregnant in the first 3 months after your delivery. So even if that one shot ends in 3 months and you make love after that 3 months, that means that if you get pregnant, your child is at least a year between them, but a year is still too small. 18 months, 2 years is just fine. 2 years between each children is just fine, because your body, even your uterus, has had time to recuperate and get itself back. The whole of your system has, all the cloasma, all the everything has come back to normal. You have gotten your real shape back, post-pregnancy shape back. Your system has adjusted itself. In fact, I need to do a YouTube video about it, because a lot of women don't actually know that these things are necessary, and we go through a lot of stress already: career stress, emotional stress, family, in-law wahala. You know, now add your own join now. Don't add your own join and make everything so complicated. So let me go back to the threatened abortion I was talking about. So I've talked about the risk factors and the general cause. So if you are experiencing the signs of low level of progesterone, it's likely that they'll be giving you shots of progesterone to help that person to maintain that pregnancy. So once you start seeing that you're spotting and you're pregnant, as you're listening to me today, just stop whatever you're doing. Stop and lie on the bed. Just stop, lie on the bed, take a rest. Then as quickly as possible, get to the hospital. It's likely they will admit you. It depends on the judgment of the obstetrician or doctor. Because if you tell some women to go home and observe bed rest, they won't. You know, now we are all the same too. We know ourselves. You'll be walking up and down say, I just wanted to pick a cup of water. Oh, I just wanted to go to the toilet. You know, if you're admitted in the hospital, what was done before? You will be on bed. You will not even be allowed to go to the toilet. If you want to wee, if you want to poo, they will give you bedpan. We will bring it. I'm a nurse. I will bring the bedpan to you. You will wee inside it. You will wee inside it. So you say, is it that bad? It can be that bad. So you are supposed to observe complete bed rest. And in cases where it's in an incompetent service, They might do some cervical sacrilege for you, that is sewing up. I'm going to do a video on this cervical incompetence. They will do some sewing up for you, sew up your cervix to make it stay. Just a few stitches, maybe 2 or 3. When delivery time has come, they're losing the stitches, and that is all, to just help to hold that pregnancy to remain in place. And if they see that your activity level is hyper, you can hyper, as in you are so good, you put off your phone, because even hearing some news can just do some activity from you and make you sit up in bed, bah, like that, when you have threatened abortion. So they might have to sedate someone that is extremely active, so that you just sleep. Your body, the whole of your system will rest, whether you like it or not. So sedation too is part of the management. Then there has to be a pad in place. In fact, when the spotting starts, you need to take along the pad or the pants that you use to the hospital, so that you can show the doctor, and the doctor will be able to estimate the level of blood loss. You understand? It might be necessary. So put a pad in place every time, all through, until the whole thing resolves. And every 3 hours, the pad should be examined by the nurse, by the midwife, or by your obstetrician. You can keep it in a pad. You can just roll it over like this and wrap it in a nylon. And when the obstetrician comes, you just show it to that person. It's as simple as that. So that's majorly the management. There's nothing fantastic about it, just bed rest, just as in rest your system. But it might take a lot of time. For some people, threatened abortion happens for just a few hours. For some people, for a few days. For some people, it goes on for weeks. For some people, it goes on for weeks. So you don't know which category you fall into, but what is important, what is most important, is that that baby is not lost. That baby is not lost. I want you to see a copy of my pregnancy support book. Yes, this book is a fantastic book. You need to see reviews. See, if you want to see reviews, I can send them to you. Just send me a message on WhatsApp. I'm going to send you. See the book. See how beautiful it is. I have copies. I have hard copies, and it's just 1,500. But really, if you want the e-copy, it's just 1,000 naira. You just send me your email, and I'm sending you the book. The book is, in fact, okay. This is a promise. If you buy the book and you don't like the book, I will refund your money. Yes. I'm that serious. I'll refund your money. Seriously. That 1,500, it's gonna make me poor. I will happily refund it. I'll be like, for me to write a book, and this book, this person read it and she did not see anything that makes sense inside. I will happily refund your money. So that is to give you the certainty that this book is worth your 1,500. It's even worth 5K. It's just that we know the Nigerian situation now. 1,500 is less than $2. Okay, 1,500 is okay. It's about $3. It's about $3. So $3 for a boy child. Bamelo, it's not gone. It is in this country that $3 is big money because of problems that we have. So I've come to the end of this video. I hope you liked it. I hope you liked it. So please share with your friends, share with other mothers, in fact share with fathers, because that man may be the one to save the life of his wife. I'm your pregnancy support partner. It's good to have you in this edition. Watch out for my next editions. Next week we are going to be having life principles. You should see it. Have a beautiful day.